So thank you everyone for coming. I'm delighted and semi-intimidated, but I appreciate it. I'm curious who, this will be mostly a lecture, so you guys have all talked to us all morning, so I won't call on you except for twice, and this was the first time. But who's taken public health, who's done a degree in public health in this room? I know you have, Rajesh, okay. And then out of you guys, who's taken a history of public health course? Okay. Interesting. Yeah. Okay. Good. Because I think that's why some of this is helpful. There's a bunch of disclaimers, right? You can't condense almost 1,000 years of history without leaving out a whole bunch of stuff. So apologies for that. There's a number of examples we could have used here that I'm not going to. So disclaimers all around. What I hope is helpful, and I'll start with these quotes from literature because I think literature helps us understand the world around us in new ways. And I think history can do that too. And you're all, if you haven't studied the history of public health, you're all engaging in a tremendous experiment in public health and in global health. But you're defined by hundreds of years of history behind it that inform everything we do, that guide our discussions from how we talk about respect for the people we serve to technical collaboration to the justifying rationales for why we do what we do. And the James Baldwin quote is a wonderful one, which notes that we carry history within us, whether or not we know it or not, and it's present in all we do. And it is present in all you're doing in the Global Fund. And then Faulkner has a briefer version of that the past is never dead, it's not even past. So I hope that as we go through these initial parts of global health history, they'll help you look at a framework for how you see the world around you based on how it developed at the time and some of the key discoveries and innovations that are still driving what we do today. So this is part one, from the 1300s to the 1800s, really from death and darkness to light. And I mean that quite literally because after our prehistory, after humans moved into larger tribal groups, began with agriculture, began settling in river bottoms where they could grow more food. They created larger societies, and these societies could then be affected by infectious disease epidemics. And ever since that time in human history, infectious disease epidemics have washed over humanity. We neither understood them nor could control them in the early days. And at times, they dramatically shifted the course of the modern world. So I'll just give you two of the biggest examples of that guide. And I should have noted here, you don't have to take notes. I've done all the slides with bullet points on them, so they're hopefully like a helpful remembering guide. Happy to hand the slides out later. So if that frees you just to relax and think about it, that's great. The first one is the Black Death, which we've all heard of, which moved from China across Asia to Europe in the 1300s. It had a devastating impact on development, on economics, on health, on politics, on social structure, and even religion. It was spread likely by bubonic plague, maybe a combination of bubonic and pneumonic plague, spread from lice that lived on rats, that spread through ship and train travel. At the time, Europe was divided into fiefdoms, city-states. Agricultural labor was performed by serfs. Private armies were raised. But the deaths from the plague, which reduced the population by 2/3 in about 100 years, radically changed the entire constellation of European societies. It encouraged more reforms. It encouraged greater control by landowners because there were 2/3 fewer people around you. There was greater surfeit of goods. It changed the way governments behaved, and in its wake, orphanages, sanatoriums, public hospitals, professional militaries all began to emerge out of the changes wrought by this mass extermination of the European population. Interestingly, the effect on the religious community was also felt. It contributed to the Protestant Reformation because the church couldn't control the plague, it couldn't explain the plague, and in the wake of it, the church often sold indulgences, priesthoods that later sowed great discontent and contributed in part to the Protestant Reformation. And finally, the Black Death period gives us the word quarantine, which in Italian is 40 days. Sylvia, I don't know if you can pronounce that for me. Quarantina, which described the quarantine of ships off the coast of Croatia, off, in particular, Dubrovnik, which is the first attempt to quarantine and therefore protect a city-state against incoming infectious disease epidemics. So an enormous change, and again, the broad theme in the early days of infectious disease epidemics washing over humanity with very little ability to control them. The second time this happened was in the Columbian Exchange, and the Columbian Exchange refers to the incredible exchange of plants, animals, foods, human populations, including slaves, but also ideas and communicable diseases between the Old World and the New World. And as you see here, a number of wonderful things moved from the Old World to the New, including pumpkins and turkey and vanilla and cacao. And a number of wonderful things moved from the Old World to the New. Coffee beans and olives, in particular, we're all very thankful for. But alongside this, this exchange beginning in 1492, were the exchange of infectious diseases. Let me just start with diseases moving from new to the old. Syphilis is suspected, as well as yaws, as moving from the New World to the Old World. And it's a good time to note just the early origins of stigma and discrimination in public health history. And syphilis is a great example of that because it's always been, as a sexually transmitted disease, a stigmatized disease. And so each country affected by it always blamed a neighboring country or an enemy for the cause of this, cause of syphilis. And so you see in the names used to describe syphilis in each country how that happens. So inhabitants of today's Italy, Germany, and UK usually call it the French disease. The French call it a Neapolitan disease. The Russian call it a Polish disease. The Polish call it a German disease. The Danish, Portuguese, and North Africans call it a Spanish and Castilian disease. The Turks called it a Christian disease. In northern India, the Muslims blamed the Hindus blamed the Muslims, and in the end, most people blamed Europeans for it. So early on, and here you see just a clear parallel with HIV, the driving factor of stigma and discrimination in making public health interventions more complicated. But the real story is the exchange from the Old World to the New. And here you see a huge range of infectious diseases, particularly plague, chickenpox, cholera, scarlet fever, smallpox, and yellow fever, as well as typhus, that wreaked absolute devastation on the populations of the Americas. These were populations that had, because the land bridge closed in the Bering Strait 10,000 years before, were immunologically naive to these diseases. So these, like today, if you have chickenpox as an adult, it can be life-threatening. These diseases had a tremendous impact on the populations of the Americas. While we don't know exactly how many people lived in the Americas in the early pre-Columbian days, the estimates are about 100 million. And post that, by about 1620, estimated that the total populations of the Americas were reduced to about 1.6 million people. So really the largest mass extermination of people in history that we know about caused by infectious disease epidemics. As with the social, political, and economic impact of the plague, these infectious diseases washing over humanity also had political impacts in the case of the Columbian Exchange. So the conquering of the Americas by first the Spanish and then other powers was greatly enhanced by the population being reduced by 95%. And it came with some other messages, right? The message that the Spanish were immune to these diseases when they first arrived, didn't seem to suffer from them, was viewed both by the Spanish and the Native Americans as sign of divine partiality towards the Spanish. And you'll see echoes of this in the later colonial period, which we'll talk about in a second. But really, a linking of two continents that caused mass extermination of people and had huge political impacts in terms of not only the deaths, but the beginning of colonization in the Americas. Sorry, I should have turned to this slide there, but this is the meeting of the Sapa Inca and Pizarro in the early days. And the Incan Empire in particular was weakened because its two leaders had died of smallpox in the years briefly before the Spanish arrival, which greatly enabled the conquest of the Americas. It's really important to point out that for almost all of human history, we didn't understand these diseases. This is a wonderful quote from The Lancet that talks about all being darkness and confusion, vain theory. We know nothing. We are at sea in a whirlpool of conjecture. We didn't know what caused diseases. They washed over us. We didn't know how to control them. The best example, one of the 3 diseases we work on, malaria, the term comes from the Latin mal air, right? Which means we thought it came from bad vapors and night vapors and bad air at night, which is of course wrong and part of the reason we couldn't control it for thousands of years. But these infectious diseases were uncontrollable. They washed over our populations, killed people in huge numbers, and we didn't have much to do about it. And you are now part of a really tremendous experiment that builds from the next couple of hundred years in controlling these diseases. Then coming out of this darkness towards light is the subject of this next section. And it's 4 cases that are particularly critical in showing the way for progress against infectious diseases. And I'd also argue that they exist today, just as Faulkner's quote illustrates. These exist today as approaches that we argue about in GAC, we argue about in concept note development, as we argue with sometimes PEPFAR about approaches. These are all inherent and embodied in ways we think about today. First, Edward Jenner, then John Snow and a cholera epidemic in London, Robert Koch and the causes of disease, and finally Rudolf Virchow on social medicine. Let me take you through each one of these. The history of vaccination begins with Edward Jenner and smallpox. From early days, and smallpox has been found on the faces of mummies from 1 to 2000 BC. So this is a disease that has evolved with humanity and always affected humanity. But there were early ways to control it. And from early Chinese experiments where they recognized that survivors of smallpox were immune from the disease, they'd take dried sore pustules from smallpox infections and either inoculate them in people. They'd do a small cut and rub some in there and you get a small smallpox reaction most of the time, but therefore be immune to it later, or they'd blow it up someone's nose in ancient China. So there were ways of recognizing that you could introduce a small amount of immunity in people by taking some samples from people who were currently infected and lightly infecting them to others. Edward Jenner was vaccinated or was inoculated in this way and performed an experiment that would never pass ethical review these days, but which has really changed the course of public health history forever. He was performing this inoculation on people in his rural English practice, and he realized local rumors that cowpox was also potentially protective of smallpox. And the reason he did this was he looked at the milkmaids and the young ladies who milked cows, and they had very fine, pale skin that was unpocked from smallpox. And so he hypothesized that cowpox, a related disease, could protect potentially from smallpox later. So what he did was he took cowpox lesions from a young dairymaid who had fresh cowpox infection, and he inoculated a young 8-year-old boy named James Phillips. And the child developed a mild illness. He developed some of the signs of cowpox, but after 10 days was feeling fine. And then, and this is the part that would not pass ethical review, he infected him with smallpox. And he took live smallpox and gave it to this 8-year-old boy. But the boy did not get smallpox. And this was the beginning of vaccination and our understanding, not of the science of it, not of the virology or immunology, but of the fact that a mild infection can protect against worse infections later. This is basically the first live attenuated vaccine. 2 other things to note. First, or just really one, the vaccination comes from cowpox, vacca in cow, again the Latin. So the term vaccination is where we get this. It's from this initial story of Edward Jenner and the milkmaids developing the first vaccination. The second thing is, sorry, there was one other thing. In the next part, we'll talk about smallpox eradication. And one of the amazing stories in public health is the fact that it took until 1980, from this period, which was mid-18th century, to eradicate smallpox from the globe. So almost 200 years. But in the past years, we have accelerated. So polio vaccine was invented in the 50s, and we are so close to eradication. And there is an acceleration of efforts to go from an advancement like vaccination to actual global dissemination much faster than we have in the past. But that is a different story. So vaccination, the first huge change in public health advancement. The second's a different one. This is John Snow. This took place in Soho in London. And at the time, Soho was not the posh, hip place it is today, but was a place of cow sheds and grease-boiling dens and primitive decaying sewers and a fetid sea of cesspits. It was pretty much, maybe Kate thinks it hasn't changed much, but
on a Sunday morning,
on a Sunday morning it has aspects of this. And in 1854, there was a terribly violent cholera epidemic. In 3 days, 127 people died who lived around the Broad Street area. Very few families were spared. Shops shuttered. People thought it looked like the Black Death again. And John Snow, who was a local doctor, began investigating this, and he did two fascinating things. First, he looked at the water under the microscope and noted, again, not understanding, just as Edward Jenner did not understand vaccinology or immunology, but noting that there were white flocculent particles under the microscope. Something was there that was not in other waters that he noted. And then he did something really fascinating, where he did one of the earliest epidemiologic maps of the cases and sought to understand where people infected by these diseases are and what could be the cause. And I'll just show you here. This is a modern overlay of his original map. His original map has these black bars that count number of cases, but in the modern overlay, they're red spots. And then here in blue, you see the pumps, right, over here. And you see them all centered around this Broad Street pump in the middle. And so he looked at this, and he suspected the pump, but there were some interesting cases. Here's the only other question I'll ask you. There's a brewery here with no cases. Can someone tell me why there might be no cases in the local brewery?
people drink the beer.
Exactly. Free beer on premises, so they never drank the well water. There was another case way up in West Hampstead, right, like 2 miles away or 3 or 4 kilometers away, of a woman and her daughter that died of cholera. So that appeared to be totally unlinked to this Broad Street pump. So John Snow walked up there and investigated. And it turns out this woman had lived on Broad Street and loved the taste of the water in the Broad Street pump. And so every day had a servant come down and bring back water. And the day the epidemic started was the last day they had brought water back up to this house in West Hampstead. So John Snow did these two things. He looked under the microscope and he did this epidemiologic investigation that showed the Broad Street pump was the very likely cause of the cholera epidemic, again, without understanding it. And what did he do? He removed the pump handle and the epidemic stopped. So he had an environmental intervention to stop a disease. And forever after, public health has been looking for similar ways to intervene in that way, to remove a pump handle, change human behavior in a way that stops infectious diseases. So it was really the start of modern epidemiology and those types of investigations. And if you go to London anytime soon, I would encourage you to go to the John Snow pub, where you can sign a guest book of honorary epidemiology members of the John Snow Club and also have a beer. The third evolution in public health was by Robert Koch. And he, for the first time, established that an organism can be linked to a specific disease. So the two previous cases, again, no understanding. But Robert Koch found that, that if there was an organism found in all cases of a disease, isolated from disease cases, produces the original infection when introduced in a healthy person, and then can be re-isolated from that newly diseased host, it would be the cause of the illness. So these are Koch's postulates that show a germ theory of disease. And it basically removes the darkness we had for thousands of years, really for all of human history, and begins the pathway to identifying specific causes of different diseases. And that, in turn, opens up the possibility of prevention, treatment, and vaccination. So that understanding is enormous. Lucica also asked me to note that he did discover the tuberculosis bacilli as well. So there is a picture of him doing that here. So no more miasmas, no more bad air, no more humors or witchcraft. This is the beginning of an explosion in medical information that only started in 1884, like, just over 100 years ago, that we have all benefited from and that then we seek to deliver in our work today.
And he had a big change management problem, though. I bet you a lot of people weren't very interested in hearing little bacteria as opposed to whatever the prevailing theory was.
Yes, absolutely. And actually, if I can go back to a point I wanted to mention, if you look at this picture, you'll see a satirist looking at Edward Jenner and vaccination and suggesting that if you give people cowpox, they will turn into cows. Right? And so in every one of these cases, you had exactly what you said, problems with change management, doubters, rumors. You still see that today with polio, you see that with HIV, you see that with almost all the diseases we work on. And you certainly saw it in terms of the germ theory of disease as well. One quick side note here, this is one of the best collections of life expectancy. Comes from data and demographic surveys in England and Wales. And we often think of the huge improvements in vaccination and antibiotics as driving increases in life expectancy. It's not supported by the data. So in fact, you'll see vaccines and antibiotics weren't widespread until 1941, World War II period, when it really began spreading. And you see before that, huge increases in life expectancy. And these were more due to better sanitation, nutrition, hygiene, and other environmental modifications that happened in England and Wales during this time. So just to separate those two and go back to John Snow and some of the environmental changes that can be wrought, those are more due to the huge increases in life expectancy than vaccine and antibiotics. The final evolution that happened was a gentleman named Rudolf Virchow, who's a doctor, investigated a typhus epidemic in Prussia. And instead of, he was actually doubtful of the germ theory of disease, but noted something that we note today, which is that social factors, the way we treat each other, the poverty levels, whether or not they're public hospitals, the education levels, were all the contributing factors to this outbreak of typhus. And that to control it, these were the things you had to focus on. He's the father of social medicine, and the idea, and his quote here, that medicine is social science and politics and nothing else but medicine on a large scale. The idea that it's not the specific diseases or the organisms or the treatment or the vaccination you need to work on. It's how we organize ourselves and take care of fellow humans that determines whether or not we get infectious disease. And you see this throughout our three epidemics. You see this in TB. This is the key POPs discussion in some ways. You see this in terms of TB in prisons. You see this certainly in terms of stigmatized populations for HIV. You see this in terms of malaria. And you see this in the broader debates about whether or not we need to cure poverty before we can get to public health improvements. This is really the beginning of a bit of a horizontal versus vertical debate in public health. And it's also what Mark talks about all the time when he talks about, we have the scientific tools to eliminate these diseases, but we're not going to get there unless we learn to treat each other better. And because those disparities will limit the dispersion of these new technical tools. So a few themes from this first part. First, the lifting of darkness of all of human history, never, ever understanding what caused this, what caused diseases, how to control them, what to do about them, misnaming them in terms of mal-air, and the beginning of the light of science coming to our current world. We see Jenner and Koch paving the way for the development of new medical tools to intervene in human health, of vaccine and antibiotics. And then John Snow showing how epidemiologic studies can help elucidate where disease is coming from, and this amazing idea of removing the pump handle that we look at all the time in terms of environmental interventions. That's essentially what airbags are. That's what stoplights are. That's what sewage systems are. That's what screened windows are in malaria endemic areas. All ways for public health to slightly change the environment, not medical interventions, but change the environment so that humans don't catch diseases. And then finally, Virchow arguing that the political and economic are actually the true causes of disease. And I think, and I hope you see all of these, maybe not the lifting of the darkness in the grant negotiations today, but I think you see all these debates in terms of how much commodities do we purchase? How do we understand the location of the people who are most affected by the diseases? And then what are the structural factors? What are the community factors? What are the religious, political, discrimination factors, economic factors that we also need to focus on, the health systems factors that impact whether or not we're successful against these diseases? And all of these began in the 18th century with these couple of people. Enter a world of colonial power, state interests, and they are used accordingly. Right? So new scientific interventions are not left alone for their own devices. They are launched into this, the world of the 1800s. And this is a few light examples of what happened. The first is that public health was crystal clearly used as a handmaiden of colonialism. Here you see death rates among European troops serving overseas in Algeria and Madras, in Windward and in Jamaica. And you see the death rates in the 1837 to 46 period are extremely high. Disease took about 25% of Europeans in Africa every year between the 1840s and 1860s. And under these conditions, the Europeans, who again, in a reverse of the immunological naivete of the Native American populations, the Europeans then, as they tried to enter the tropics, would get dreadfully sick very quickly. And so they couldn't really effectively colonize areas. And the advent of quinine, where you could protect against malaria, you took it the first day you're on shore and for 14 days after, basically radically reduced death rates of European troops and therefore enabled the colonization of Africa and other tropical areas. So the question for colonial powers had changed from what can we do here given the fact that 25% of us die every year to how can we use public health to protect ourselves to carry out the imperial activities we believe are in our national interests. So public health's origins are really, in the state level, used in forwarding colonialism and protecting the populations that had access to these interventions to achieve their state goals. There's some really, public health was also a legitimizing justification, right? So when these efforts were sold back to people living in Europe, they were not presented as only protecting us, but they were part of the civilizing mission of the colonial powers. They would talk about, even the most egregious colonial powers, the Belgians in Congo, would talk about the humanitarian influence they sought to have and how they'd help local populations, and this was part of the civilization of the poor world. So early history of public health clearly linked here. There's some egregious examples. The worst one here is Sir Geoffrey Amherst, for which a school is named after him, although goodness knows why, and you see actually the text, the red text here is just a copy of his letter above saying, I will try to inoculate the Indians by means of blankets that may fall in their hands, taking care, however, not to get the disease myself. So an early instance of using smallpox as a biological weapon against Native Americans during the French and Indian War. But there are also other examples, including just the basic ones. The founding of my school, the London School of Hygiene and Tropical Medicine, was on the Royal Albert Docks, which is, of course, where the ships from the colonies came back. It was very much expected to have the public health school was very much expected to help the colonial powers, to help the colonial enterprise and protect those troops against disease. It wasn't just about strategic impact, though. There were some interesting things that were linked to trade and diplomacy, and the origins of public health diplomacy can be linked to the first International Sanitary Conference of 1851. Interestingly, we think of globalization and flights and internet as a modern occurrence, but these sanitary conventions were driven by globalization of the time. It was ships and railways, but it was definitely enough to begin rapid movement of disease across populations. And so the European cooperation on cholera, on plague and yellow fever began in 1851 because trade and movement of people, in what we think of as globalization today, was moving people quickly and interrupting trade. So the quarantines set by different countries, the borders closed because of disease were interrupting trade. And so European powers got together and for 100 years had a series of sanitary conferences designed to coordinate infectious disease policy across countries. Interestingly and somewhat amazingly, these actually live on today. So if you recall the WHO banning travel to Toronto or to Hong Kong during the SARS outbreak, or you recall some of the disease warnings that happened during the Ebola outbreak, the international sanitary conventions evolved into the international health regulations, which are now used still to coordinate states' responses to infectious disease epidemics. And we'll talk a little bit more about them in the next period. Two more examples from here about how public health enabled state power and how it was used for this purpose. And it's important to emphasize this because this is not how we currently think about it, right? We think about humanitarian work and doing good and saving the most lives. But this is not the history of public health. A man, a plan, a canal, Panama, it's one of the longer palindromes in the world. And my public health history teacher noted it. That means it's the same forwards and backwards. So that's the title. The Panama Canal is a spectacular example of the power of public health to either stop or allow the strategic interests of states during the 18th and 19th century. So the French, after successfully concluding the Suez Canal, tried to tackle the Panama Canal and sought with tens of thousands of troops and staff to build a linkage between the Atlantic and the Pacific Oceans. This was more challenging than Suez in a number of ways. There's a high mountain range there, but it was really the malaria and yellow fever that stopped them. This is still pre a strong understanding of what caused malaria. So despite a huge effort by the French, numbering 20,000 men, huge numbers died or left the service. And the way the French had set themselves up there made things worse. So they had no screens on the buildings, no screens in the hospital, no screens on beds. And then most famously, pans of water were placed underneath the beds of the hospital beds in the malaria wards to ward off the night vapors. But which, of course, actually put malarial patients next to ideal malaria breeding grounds and exacerbated the epidemic. So the French efforts in Panama failed, and the French were later withdrawn. Teddy Roosevelt, president in the U.S. in 1901, really wanted a link between the Pacific and the Atlantic. He wanted this because one of his battleships was destroyed in Cuba, and it took 67 days for a replacement ship to sail all the way around the Horn to get there. So this was a clear strategic rationale for building it. And he appointed a U.S. Army general named William Gorgas to do this as head of sanitation. And he did have a theory that the Aedes aegypti and Anopheles mosquitoes carried yellow fever and malaria. And so he took action and poured oil over every waterway, dripping cans of oil over every creek, cut back foliage, screened in houses, had separate malaria quarantine wards for if someone was malarial, they stayed in a screened-in area. He fumigated huge parts of the area, and while he did not help the populations near the canal zone, he did succeed in almost eliminating malaria and yellow fever from the canal zone. And then, of course, the U.S. succeeded in building and owning the Panama Canal for the next 100 years. So a clear example of public health as a handmaiden of colonialism, as empowering states to get done what they wanted to get done, because they were, for the first time in human history, protected against some of these diseases. In another fascinating example, and there's a great book on this, Maria Espinosa talks about the invisible generals of June, July, and August in Cubans' war with Spain, war for independence against Spain. And the invisible generals of June, July, and August is the yellow fever epidemic. And the Spanish troops, again, were immunologically naive to it, and the Cubans would melt back into the rural areas and just let the Spanish suffer and die. And eventually they retreated. However, the infectious diseases didn't protect Cuban independence for long because outbreaks of yellow fever in Havana spread by boat to New Orleans and then up to the U.S. South, where they caused large epidemics. And it was one of the factors, amongst a few other political factors, that caused the U.S. invasion of Cuba in 1898. And there's actually, just to note the importance of public health, when the U.S. Ceded back control of Cuba in 1902, there was actually a sanitary clause to the agreement to cede power, which said that the Cuban government must maintain the sanitary measures the U.S. has implemented under threat of U.S. invasion. So some really fascinating examples of how once these scientific discoveries were made, how they were used by colonial powers to achieve their own interests. We haven't talked about the hookworm campaign yet, but the Rockefeller Foundation had a huge role in this. And it, again, driven by top-down campaigns, not a lot of CCM or consultations here. There was a lot of effort for rapid engagement, rapid impact, with very little local engagement. The interests were not on local populations primarily, although again, public health was used as a rationale, a more moral rationale for colonialism and what these powers were doing. Often this was extraordinarily paternalistic, if not immoral. And you see one quote here from the bottom about Filipinos seeming like so many children who need a strong hand to lead them in the path they are to follow. And this was really a lot of the early justification and rationale behind public health. And then finally you did, and we'll talk about this more in the next session, you did have the beginnings of some primary healthcare efforts about community health workers, about communities coming together in China and Java and Sri Lanka in particular, but in other areas as well, to start to use these advances to improve local health, to improve local sanitation. And so you had the beginnings of a primary healthcare movement, which met its apogee in the next lecture in the 60s and 70s, but which we're still struggling with today. And the pushback towards health systems is part of that broader debate. So a really extraordinary progress from lack of knowledge to a few people who saw how diseases were transmitted, how environmentally we could potentially control them, how we could use vaccination and understanding of diseases to counter them, and how potentially it's actually all about the societies in which we live that determines disease transmission. And then how that knowledge was used over the 1800s and early 1900s by colonial powers when the Johns Hopkins School of Public Health, when London School of Public Health was set up, both to protect colonial powers, to expand colonial powers into areas they couldn't go before, and as a moral rationale for colonialism. In the next section, just to give a preview, we'll try and take you through 1913 to the present. Some extraordinary successes. This is Ali Mau Malin, a Somali hospital cook who was the last case of smallpox on the earth in 1977. And really an incredible success that moves from Edward Jenner's discovery of vaccination to a global campaign that was fought out between the USSR and the US in terms of which was their favorite elimination campaign, malaria or smallpox, which almost failed, which had almost no funding, but has become the most extraordinary success story in all of public health. To some other campaigns, like polio, we're down to, I think, 6 cases this year only in Afghanistan and Pakistan. Guinea worm, very, very close to eradication. Again, not with a vaccine, with environmental interventions and treatment. Broader successes in terms of vaccination, of which Gavi's been a huge part, in terms of not having almost 200 years from the invention of a vaccine till it actually gets used in all the populations in need, but shortening that time period. Some really fascinating successes on the evolution of the international sanitary regulations into the international health regulations, which are still fraught with difficulties, but which are an actual tool for controlling infectious diseases across countries. And of course the founding of the Global Fund and PEPFAR to work on AIDS, TB, and malaria, and some of what drove that. Some failures as well. The smallpox eradication campaign was actually preceded by an effort at malaria elimination in the 50s, which failed. It didn't entirely fail. A couple of countries that did make progress, but certainly not at a global level, and certainly not in Africa where the burden was highest. The primary healthcare movement, which has echoes of the HSS or RSSH debate today. A huge conference in Alma Ata, which suggested primary healthcare for all by the year 2000. I think it's obvious how well we've delivered on that. And then broader discussion about the social determinants of health. Again, echoing Rudolf Virchow and the idea that these diseases aren't just transmitted in a biological way, but in a social way. And then some big challenges going forward. Emerging infectious diseases, new diseases like Ebola emerging out of areas where we have not had dense human populations, but now their ability to travel by air very quickly around the world. Bioterrorism, or the threat of synthetic biology, where humans can actually have the tools now to create new viruses or resurrect old ones. We think smallpox is only located in 2 laboratories, one in Atlanta, one in the former Soviet Union, one in Russia, but there's likely samples of it left somewhere else. There's likely you could dig up a sample and recreate it as well. So threats there. Threats of chronic conditions. I've talked only about infectious diseases, but we now have chronic conditions that are the biggest killer of people in wealthy countries and are becoming a bigger and bigger burden of disease in poorer countries. And then most interestingly, I think for our Global Fund discussions, the continued debate between the vertical and the horizontal interventions. What role do we play in social change and human rights and other types of interventions that get at Rudolf Virchow's idea of social medicine? And how much do we focus on the vertical interventions, the vaccines, the treatment, and how much do we incorporate environmental changes that we can make in terms of bed nuts or getting at the idea that we can remove this pump handle and improve health, but all themes that carry on from the 1800s and those early discoveries to our work today. So hopefully helpful, hopefully interesting in terms of putting some of the history of public health in your context today, and huge thanks for your attention.